This lady says she's seen some lips in the audience and she wants them. I want those lips, like when Harry met Sally. I'll take what she's taken, right? Okay, so this is Restylane Fine Lines, and this is the smallest product that they have with all hyaluronic acid. And what I like this for doing the teardrops in her eyes. So what I'll do here is, I'm just going to fill up her eyes, a little pinch here, open your eye please. I'm just going to go right down onto the bone. So this is really an you should really have this done by somebody who really knows their eye anatomy and knows what they're doing, because this is potentially a dangerous area to go if you don't know what's going on. Okay, you can see it's almost gone on this side. She's hollow all the way around, and this will smooth out nicely once the swelling from the local settles down. And so you can see that she's much less hollow, much less shadow. This will start to fill out a little bit, and I'll massage it afterwards. A little bit more on the side here. And what I'll do next is I'll do her cheeks. You look at her now. What we'd like to create, sorry, this comes in and out. Could you give me half a smile? See, she looks better when she has not that much cheek, but more cheek than what she has. Because she's, stop smiling for a second. She's descended a little bit. If you look at her, this is her cheek right now, and her cheek should really be up here. But she, I know Penelope, and she has lost quite a bit of weight. And she looked fine before she lost her weight, and then her face sunk down. Is that right, Penelope? Okay, so we're just going to volumize her. So here we go into the cheek. Now her cheek doesn't look as flat as it really is. She has quite a bit of freezing in her. You have to be a little bit careful. Here I am right on the bone. And remember, this is instead of giving her a facelift, or instead of doing a cheek implant. So what we do is we're just inflating this cheek, and I'm trying to increase her facial projection to make her look better. Here's another cc of pearling, and we'll volumize this cheek. And as you can see, she's very comfortable. And I'm right on the bone. So remember that she'll only have to come back in a year probably for this procedure. And probably in a year, half of it will be gone, maybe 2/3 of it, and she'll just need a top up. Let's have a look at her cheeks now. We'll sit her up, and now we've given her a nicer, fuller cheek look. Can I have some Restylane, please? Okay, so now what I'm going to do, sorry, it keeps cutting out. Now what I'm going to do is just look at her nasolabial folds, and I'll fill those out with some Restylane. I like to do the wrinkle first, just chase the wrinkle a little bit to fill it up, go a little bit more shallow, and then I'm going to put some structure and support in and go a little deeper. Before, all we used to do was to chase the wrinkle, but now we know that we need to fill the area and give her structural support, just like in a house. Her chin is a little bit weak. I'm just going to give her a little bit in her chin. She's going to feel that, and just balance her chin a little bit to her nose. So to make her nose look a little less prominent. What I'm going to do now is inject her lips. And she likes big lips. Everybody likes something a little different. Okay.
We all want what we don't have.
Okay, great. So I'm going to put some in the middle here. We'll pinch. Always pinches in the middle. To give her something, a little bit of a pout. She'll tell us. We'll show her in the mirror. And I'm not going to give her quite as much in her lower lip because it's quite big already. And sometimes patients will ask for things that you don't want to do, and sometimes we just don't do that. You know, if I think that it's going to look too big and just not going to look right, then I won't do it. I guess when I was younger, I used to do it. But it's a privilege of being busy that you can Sorry, and I also think that it's our responsibility to help you decide what's right for you. The most common areas are the tear troughs, so the eyelids, the cheeks, nasolabial folds, and lips. But you can use it in the eyebrows. Her eyebrows are nice and high, so she doesn't need it. The temple is another really nice place where people age, they get hollow temples. We use it for rhinoplasty. She has a nice straight nose, but if she had a little bump here, we can disguise the bump. We use it for jowls, to disguise the jowls, and I think those would be the main areas that we use it for. And next, after the neck in an older woman, the jowls are the thing that really bother them the most. So what I'm just doing here is, I am just disguising her jowls a bit. And these are vertical injections, which is a different technique than we used to use, and giving her volume, structural support. The question is, how often do you need to have it done? Usually we say every 4 to 6 months for the shallower injections, but for the cheeks and the deeper injections, once a year. Okay, here you go. So you can see, if you look at this side here, she's much smoother through here now. It's as if she's had her jowls moved. Okay. What do you think? Do you need anything? I think she looks good.